The one thing men get concerned about when getting a penile prosthesis is, you guessed it, size. And I get it. You start doing your research and go into online forums, and all you read about is about guys being extremely concerned about their size after surgery. Honestly, if I didn't know anything about the topic, I would be concerned too. So let's go in depth today to discuss why many men specifically say they lose length after penile implant surgery. Hello everyone, my name is Jonathan Clavell and I'm a urologist and men's sexual health expert specializing in penile implant surgery. In this video, I would like to discuss the factors that can affect the size during and after penile implant surgery. If you have seen my previous videos, I often explain that what determines the full length and girth of the implant is a sheath that surrounds the erectile tissue called the tunica albuginea. The inside of a man's penis is a smooth muscle that acts like a sponge. A sponge usually expands with water. On the other hand, the erectile tissue engorges or expands with blood. However, that sponge is limited by that tunica albuginea. Once again, the penis has smooth muscle on the inside. And when healthy, that smooth muscle is routinely being exercised whenever a man has an erection. And whenever that smooth muscle is not being routinely stretched out, what can happen? You guessed it, it can lose length. For example, a man who goes routinely to the gym and starts lifting weights will very likely notice growth of their skeletal muscle. However, in order to keep that muscle mass, he will need to continue exercising those muscles. If he stops lifting weights or all of a sudden gets a massive injury and you get that muscle in a cast, the muscle does not get routinely exercised anymore and the previously grown muscles will atrophy. What does muscle atrophy mean? Many people don't realize that when you don't use a muscle for a long time, it can shrink and become weaker. The same thing can happen to the penis. Erections bring oxygen-rich blood to the tissues, keeping them healthy and strong. If someone experiences ongoing erectile dysfunction, that blood flow decreases and over time, the tissues in the penis can shrink and lose function, just like an arm or leg that gets smaller after being in a cast for weeks. Now, back to the smooth muscle within the penis. You do not need to be sexually active in order to keep the penis exercised. Because believe it or not, a healthy man is routinely exercising that penis at night while he sleeps. A healthy man with a healthy penis gets an average of 3 to 5 erections, each lasting 20 to 30 minutes on average every single night when he sleeps. And when that penis stops receiving healthy blood flow and erectile dysfunction starts kicking in, we start losing those nighttime erections and the penis starts to atrophy. Not only does the blood vessels and smooth muscle within that penis will atrophy, but also its tunica albuginea. Now, depending on what has been affected, the smooth muscle or the elasticity of the tunica albuginea, a man can lose size and length. Hopefully, you understood this part. Now, there are multiple things that can affect the size of the penile implant whenever it is placed. Let's talk about them. Number 1, Peronis disease. Peronis disease is a medical condition in which a man develops scar tissue that we refer to as a Peronis plaque within the tunica albuginea. This can lead to a curvature in the penis, a deformity, and loss of elasticity. This Peronis plaque directly affects how much the penis can stretch out. Why? Because the scar tissue causes the tunica albuginea to lose its elasticity. This prevents the penis from stretching. Almost all men with Peronis disease describe loss of penile size as one of their symptoms. And when we place an implant, doesn't matter how aggressive a surgeon can be, a man will very likely notice that they have lost some size if they compare it to when they were younger. Second factor that can affect final size, use of injectable medications for erectile dysfunction. These include, but are not limited to, Trimix, Bimix, Quadmix, Caverject, and Edex. These medications contain active ingredients that can cause scar tissue within the smooth muscle of the penis and the tunica albuginea. Injectable medications for ED can sometimes even lead to Peronis disease. Also, some experts believe that the actual act of injection, that is sticking a needle inside the penile tissue, creates microtrauma and scar formation, which can also prevent how well the penis stretches at the time of surgery. Does this mean you need to stop Trimix injections immediately? Not necessarily. There are some men that use injection therapy for years and are not affected by this. But just be aware that these medications can lead to scar formation and in some occasions, atrophy. Third factor that can affect penile size, body habitus. That is our weight. Yes, excess body fat, particularly the fat in front of our pubic bone, what we call pubic fat, can contribute to perceived and actual loss of penile length in several ways. As we gain weight, fat accumulates in that area above the penis, and this can engulf the base of the penis, making it appearing shorter. In reality, the penis is the same length, but a portion is hidden beneath the fat. This is one of the main reasons many men say that the length of their penis within a vacuum erection device was significantly longer than their implant. Whenever we use a vacuum pump, we are creating pressure against that suprapubic fat, and that will cause the penis to get exposed more, making it look longer. Without that external pressure, the penis is covered by the surrounding fat and will look shorter. Moreover, obesity is also linked to poor vascular health, inflammation of the blood supply, and low testosterone, and these all can lead to atrophy of the penile tissue. But this is a topic for another day. Fourth factor affecting the size of a penile implant: when or how soon after surgery you measure. Right after surgery, men will have bruising and swelling in the scrotum and the prepubic area, which will affect how long the penis looks with the penile implant. More specifically, it is not the same thing for you to measure a few days after your surgery when you still have a ton of swelling around your penis than measuring 8 months to a year after surgery when you have allowed time for your body to recover. For example, if you undergo a plastic surgery for your nose, commonly known as a rhinoplasty or a nose job, the first few days after surgery, you will look very swollen and bruised, like Mike Tyson just beat you up in a boxing match. However, that is not your end result, because months later, that nose will very likely look close to perfection. Also, are you measuring when aroused or without arousal? Remember that when you are aroused, the glans or the head of the penis also engorges, and that can make your penis look longer. Fifth factor that can affect the size of a penile implant, and a very important one: timing of surgery. We wait too long to get it done. Think about it. It is not the same thing for us to place an implant on someone who's still able to get erections with injectable therapy and was able to have sex fairly recently, compared to someone who shows up and tells a surgeon that he has not had an erection in 10 years. We already talked about this. When a man has prolonged erectile dysfunction, the penile tissues are not getting regular blood flow or proper oxygen. This lack of oxygen leads to fibrosis or scar tissue in the erectile chambers. Fibrosis then can lead to less elastic tissue, making the penis shorter and stiffer. If the penis has atrophied significantly, only a shorter implant can be placed, which can permanently reduce the length of the penis compared to what could have been preserved if we would have undergone the surgery sooner. In summary, when it comes to penile implant surgery, size concerns are real, but much of the perceived loss comes from changes that happen before the surgery, not during the surgery. Things like smooth muscle atrophy, reduced nighttime erections, and the effects of long-term erectile dysfunction can be factors. When the penile tissues don't get regular blood flow, they lose their elasticity, and this can make the penis appear shorter over time. If you're considering a penile implant, the key takeaway is don't wait too long. Early intervention can help preserve as much size as possible and give you the best possible outcome. And last but not least, remember one thing: I've never met a man that wants a penile implant. We just get to the point that we need one. In the hands of an experienced expert, most men are satisfied with their result. Thanks for watching.